Hello, my name is Mike Tyler and I'm going to talk to you about the complications of an open rhinoplasty. We've already discussed the reasons why you might want to have a rhinoplasty operation, and we've also discussed what you have to go through when you have a rhinoplasty operation. So I'd like to just talk about the risks. It's very important you understand the risk before undergoing any form of voluntary surgery. The risk can be divided really into two groups: those that are associated with any operation because you're having a general anaesthetic, and those that are specific for a rhinoplasty operation. Now, those that are associated with any operation because of the anaesthetic can be very, very rare. Most anaesthetics are very safe. However, the most common and perhaps one of the most significant that I always mention to patients is the risk of a DVT. DVT stands for deep venous thrombosis, and it's the same as economy class syndrome that you may have heard from, and it's basically a clot that you get in your leg from the result of immobility. You can get it for a number of reasons: travelling economy class, hence its name, to America, travelling on a bus. You can also get it when you're pregnant. But anaesthetic is known as a known risk factor. We take precautions against that. We give you flight stockings, we give you calf squeezes, but you can't get that risk absolutely to zero. So that's a small risk that I think you have to take on board. The rest of the risks of the anaesthetic are extremely rare, having an allergic reaction to anaesthetic or untoward events. And I'm not going to discuss those any further, although if you have any specific concerns about anaesthetics, then obviously please feel free to contact us and we can discuss those with you. Now, those risks that are specific to the rhinoplasty operation themselves, again, I'm going to divide into those which occur immediately and those which perhaps occur with a bit of time. In the first instance, the nose is a very vascular structure, so there's always a risk of bleeding. That's why we keep you overnight, because if you do get any bleeding after the operation, the nurses and the surgeons, myself, or the team can deal with the bleeding. It would be very rare, but it has happened that we'd have to take you back to theatre if the bleeding was sufficiently large. Again, that's very rare. It's not something that I personally have had to do yet in my career. I touch a bit of wood. The other risk associated with a rhinoplasty, there's always a risk of infection. Infection is most common around about day 5, and you notice infection because the nose will get very swollen and very painful. Probably your eyes will also puff up. Infections can range from a little bit of redness that I give you antibiotics for that settles very quickly to serious infections. Very, very rarely there are people that have had significant infections in the base of the nose after a rhinoplasty operation, and that is something that we know is available, and that's something that we wish to treat. That's why we wish to treat any infections long before it gets as serious. But out there in the world, there are patients who have had serious infections after a rhinoplasty operation, and again, it's something that you just have to be aware of. Wound healing is another complication of any surgery. Thankfully, the nose is very vascular and therefore usually heals beautifully, but occasionally patients do have some areas which take a little bit longer to heal. Very rare that this actually affects the end result. People also notice different amounts of swelling, and although everybody gets swelling, some patients will get more swelling than others. It takes longer to settle down, so swelling is another risk that you want to take, or prolonged swelling. The nose will be numb, so again, it is possible to injure the nose, and especially in exposure to strong sunlight, you can get sunburn without noticing it, or you can injure it perhaps in other ways, so one has to be a little bit careful. That's another risk factor. I think one of the other main things to take on board with a rhinoplasty is that the effect of the operation cannot be absolutely guaranteed. It's very important to be aware of what the surgeon is trying to achieve and make sure that corresponds with what you wish to have in your nose. And so most surgeons that do rhinoplasty operations have a revision rate. In other words, a number of patients who come along and there's a little aspect of the operation that needs to be changed. Thankfully, if you have surgery, as we do at BMI hospitals, any change that we do within the year is done free of charge on the original price. The sorts of things that I have had to do myself in the past for other patients, and perhaps if I've had a patient with a very large nose who I made smaller, we wish to have it smaller still, and we did that as a revision. The other things that I've noticed occasionally, we have little bits of cartilage that we've involved that just give little hard edges, so occasionally I've had to go back in with a little rasp just to notice a little imperfection on the dorsum of the nose. We obviously take a great deal of care in making sure that when we discharge the patient, they're as happy as we can possibly make them. Those are the main risks. Obviously, that's not an exhaustive list, but I think those are the key factors that you need to be aware. information if you decide to go ahead with the operation.